Hi, my name is Mike Reese, and I am a registered dietitian and practitioner consultant. In this video, we will be talking about the less stress diet with keto adaptation. If your clients eat the standard American diet, chances are they've lost the ability to burn body fat despite carrying around an enormous supply of it. For starters, eliminating excess sugar and grains from the diet will help retrain your patient's body how to burn fat for fuel. Typically, restricting carbohydrates to 30 to 45 grams per day, along with an appropriate amount of protein, is enough to starve the brain into ketosis. We typically start with a bone broth and avocado fast for 2 to 3 days. Measuring with ketosis urine strips, we continue the fast until we get a positive reading. Some will get there on the second morning, while some will get there on the third. Exercising, particularly while fasting, is also very effective at jump-starting the body's fat-burning engine. The more consistently your patient exercises, the better their body will be at using their own fat stores for energy. When it comes to your ketogenic engine, you either use it or you lose it. Interestingly, the exercise gives you a better effect on serotonin and dopamine during the keto-adapted process as well. The key is once the patient reaches ketosis, you will then start adding back the carbohydrate snacks, but to do 3 15-gram snacks instead of 30 grams. According to the research done at MIT, when you are keto adapted, 15 grams of carbohydrates will have the very similar effect on serotonin as 30 grams would when you are not keto adapted. We also suggest using beets as one of the carbohydrate snacks because they have fantastic micro-antioxidant properties. Want to supercharge the effect of the diet? Well, then add these spices to your patient's meal plan: ginger, garlic, and turmeric. These 3 spices supply the body with antioxidants and neuroprotective agents that will kick your patient's mood into a higher gear. Typically, we use these during the protein intervals to spice up our protein sources, but it's also fun to add turmeric to squash for their evening or dinner carbohydrate snack. 15 grams of carbohydrates from squash is about 3 to 4 cup of squash. We add 2 teaspoons of turmeric to the 3/4 cup of squash with some potassium salt and 1 teaspoon of grass-fed butter. You'll be surprised how much of an impact this snack can have on your patient's mood once they are keto adapted. Remember that with any diet you need to pay attention to their hormone levels and circadian rhythm throughout the entire process. In some cases, there will be shifts when doing a keto adapted alteration to the less stress diet. Make sure your patients keep a detailed journal of their feelings and energy levels throughout the day so you can adjust accordingly. Keep an eye out for the next video on how the anti-inflammation diet adaptation works. You will be shocked at how many synergies you find when you fully personalize the diet to your patient's body.